Several members, Dr. Lam, Mr. Lim Biao Chuan, Ms. Jessica Tan, Ms. Janice Koh, Mrs. Lina Cham, have raised a concern shared by many Singaporeans, and that is how to keep healthcare affordable. How do we help Singaporeans pay for their healthcare costs? Today, we have a financing framework comprising 4 pillars: subsidies, MediSave, MediShield, and MediFund, what we usually call 3M, and subsidies. While we manage costs and ensure that we are effective in the way we deliver care, we also need to enable patients to pay for their portion of the cost. The subsidy and 3M framework has served us well so far, but we need to further strengthen this as the healthcare needs of our population evolve over time. The review of our healthcare financing system will be extensive and will involve fundamental shifts. Therefore, it will take more than a year to complete. Let me take this opportunity to share some of our initial thinking. The first major shift is to increase government's share of national spending to provide Singaporeans with greater assurance that care will remain affordable and accessible. Government spending will not only rise in tandem with the increase in national healthcare spending, we will in fact take on a greater share of national spending from the current 1/3 to about 40% and possibly even further, depending on various factors such as demographics and our ability to manage healthcare costs and target our subsidies. This will help to reduce the impact of rising healthcare costs on Singaporeans, especially the lower to medium income Singaporeans. However, how we spend the additional money is also crucial. Today, the bulk of our subsidies go towards hospitals where the cost per episode is high. And as our population ages, delivery of healthcare will increasingly extend beyond hospitals. Many Singaporeans, including Dr. Chia Shi Lu, have given feedback on the cost of outpatient care. We have enhanced CHAS to make primary care at GP clinics more affordable and raised subsidies for drugs to help lower and middle-income patients. In our review, we will explore how we can provide more financial support in a targeted way for specialist outpatient care, primary care, preventive health care, dialysis, and long-term care to reduce the share the patients have to bear. The second major shift is on MediSave. We have been expanding MediSave use progressively since 2006 to include outpatient treatments for chronic diseases as well as selected vaccination and screening. Now Singaporeans can use up to $400 per MediSave account to pay for these each year. MediSave has been sized primarily to pay for subsidized care in the inpatient setting. As we grow old, we are more likely to require hospitalization, and each hospital stay is longer. If we allow unrestricted use of MediSave, many of our elderly may not have sufficient MediSave for their needs in the future. And we do exercise flexibility on the ground for cases with exceptional circumstances. I believe if we calibrate carefully and put in place some safeguards, we can allow greater flexibility in the use of MediSave to reduce out-of-pocket costs without jeopardizing our future. We will review MediSave policies to see how to have greater flexibility in the use of MediSave. The government will continue to provide additional help for lower income and the elderly to save more through MediSave top-ups under the Workfare Income Supplement and the GST voucher for MediSave. In the budget, DPM Tharman announced higher WIS payouts for lower income workers and doubled the GST voucher MediSave payout this year for eligible elderly. In addition, $200 will be provided to all citizens 45 years old and above. We will study what else we can do to help Singaporeans build up their MediSave balances so that we can allow more MediSave to be used. The third shift is on the role of insurance. As Dr. Chia Shi Lu mentioned, we need to calibrate the balance between personal saving through MediSave and the role of MediShield by risk pooling. For us to stretch the health dollar and to give Singaporeans greater peace of mind, we need to enhance the role of insurance, such as MediShield and ElderShield. But we need to do this carefully to guard against over-servicing and overconsumption, both of which will lead to rising costs and higher premiums for all of us. We will study how we can shift the balance towards greater insurance coverage without driving up demand and consumption, and allow insurance to carry a larger share of healthcare funding. Together with an enhanced government share I mentioned earlier, this can help to reduce the need for individuals to pay more from Medisave or cash. We recently enhanced MediShield to include congenital and neonatal conditions and gave each Singaporean baby a hongbao of $3,000 in his own Medisave account. This is a significant step towards making MediShield coverage universal for the younger generation. We will next need to look into how to help the older Singaporeans stay insured under the MediShield, a point which Dr. Livigno raised. MediShield is designed to be a catastrophic insurance, primarily for larger inpatient bills. As we review how we can strengthen insurance coverage, we will also examine whether it should remain so, or if we can expand it so that it can offset a higher proportion of costs while keeping premiums affordable. We will also have to address Singaporeans' concerns about exceptionally large bills that go beyond the current cap of MediShield claims. Let me now turn to address the specific concerns of our elderly today. Budget 2013 will deliver an additional package of one-off Medisave top-ups for the elderly. But in addition to these ad hoc top-ups, we will need to review how best to support the healthcare needs of our elderly, especially the very old today. Many of these are our pioneers, and they may not have accumulated enough Medisave by the time they retired. We need to take care of their healthcare needs, and this is a priority area that we will be looking into in the review. Dr. Chia and Mr. Heng Chi Hao raised the issue of Elder Shield. As the care needs of our seniors expand and become more complex over time, there is a need to revisit the coverage of Elder Shield. We have started the review of Elder Shield, but rather than to review Elder Shield on its own, we really need a more fundamental review of the roles of government subsidies, insurance, and individual share of healthcare costs, and how aged care fits into this big picture. We will review Elder Shield as part of the overall review of our financing framework. While we carry out this review, which will take some time, we will make a few immediate changes to strengthen our safety nets to keep healthcare affordable. First on Medifund. Medifund plays an important role as a safety net to help provide peace of mind for both lower income patients as well as middle income patients with larger bills. We introduced Medifund Silver in 2007 to take care of our needy seniors, and we recently announced the establishment of Medifund Junior to help needy children. Ministry of Finance will be topping up the Medifund capital sum by $1 billion. This will increase the annual Medifund assistance by about 20% to $120 million to help more needy patients with their healthcare bills. We will use some of the additional Medifund monies to close existing gaps in Medifund coverage. Mr. Patrick Tay expressed concern about the high cost of dental treatment. From 1st April 2013, we will extend Medifund assistance to patients at the National Dental Centre. In addition, Singaporean mothers who face difficulty paying for their antenatal care and delivery can also be assisted by Medifund. By June 2013, we will also extend Medifund to the polyclinics, including dental services there. This will provide some relief for needy patients. We will continue to see how we can make our safety net more effective in giving Singaporeans greater assurance. Dr. Chia Shi Lu mentioned rare diseases. We will also explore how we can help this group. Next, on cost of drugs. The cost of drugs is also a concern for many Singaporeans. We provide subsidies through the Standard Drug List, or SDL, and the Medication Assistance Fund, MAF, to ensure that drugs are kept affordable for our subsidized patients. From 1st April this year, we will add 17 new drugs onto the SDL and MAF. These drugs include second-generation insulin products and insulin pen fills to help lower the cost of diabetic patients. Finally, let me address a topic that many members have raised over the years, and which was also raised by Ms. Tin Pei Ling and Dr. Lam Pin Min recently at this debate. Dr. Chia Shi Lu also asked about this just now. This refers to transaction charges for Medisave claims. This is a fee of $3 for each Medisave claim that patients make. As I explained last year in a PQ reply to Mr. Ong Teng Koon, this charge goes towards the cost of operating the Medisave scheme. However, I understand that this fee may pose a burden on patients, especially the lower income or those who need to use their Medisave frequently to pay for chronic disease treatment. My ministry has reviewed this, and I'm happy to let members know that with effect from 1st April, MOH will absorb these transaction fees fully.